Prescription opioid overprescribing, as well as opioid misuse and overdose, remain significant U.S. public health issues. As prescribers of opioid pain medications, surgeons and dentists play a pivotal role in minimizing opioid use in their patients. To address a deficit in educational resources for clinicians, the University of Michigan Injury Prevention Center, in partnership with the Michigan Department of Health and Human Services, created the Michigan Safer Opioid Prescribing Toolkit, one of the first fully online, comprehensive, evidence-based clinical resources to address the opioid epidemic. When you land on the Toolkit homepage, you'll see resources curated across 8 domains. If you hover your cursor over a section's icon, a brief description of what you can find in that section will appear. You can also use the menu at the top of the screen to explore the toolkit and directly navigate to a specific page. The toolkit has some excellent information for providers in both dental and surgical settings. Taking some time to click through each section is a great way to see what the toolkit has to offer and allows you to review the topics that interest you most. The section on prescribing guidelines offers resources and recommendations for safer prescribing. You'll find a summary of best practices in dental and surgical settings from the Prescription Drug and Opioid Abuse Commission and Michigan Opioid Prescribing Engagement Network. These recommendations will assist dentists and surgeons in treating patients through all phases of treatment, from preoperative to postoperative care. You will also find a section on non-opioid options for pain management, offering evidence-based non-opioid treatment options for treating pain, as well as tips for talking to patients about these options. Additional information on having conversations with patients can be found in the background section of the toolkit under Difficult Conversations. Here, there are resources on building strong patient-provider rapport, including examples of what you might say to a patient in different situations. There is also a section on reducing stigma. Here you'll find an anti-stigma toolkit as well as webinars and articles that discuss stigmatizing language that should be avoided when discussing opioid and substance abuse. One of these resources, the Words Matter handout, was created as a guide for using people-first, non-stigmatizing language. It can also be found under the Handouts tab, where there are additional handouts and posters that can be tailored to your practice and include your organization or clinic's logo. The toolkit is continually updated with the newest, most up-to-date information for you and your practice. Scroll to the end of any page in the toolkit to sign up for our listserv to be notified when new resources are added. If you have resources that you think would make a good addition to the toolkit, or for any other inquiries, contact us at uminjurycenter@umich.edu. You can also click on the evaluation button at the bottom of the homepage or the contact and subscribe button on the bottom of each page to leave your feedback and suggestions.